Health is a huge topic, isn't it? When you think of like all the number of different approaches, even in allopathic medicine, like normal, standard, orthodox medicine, all the different specialties, approaches, fields of study and expertise. And then you think of all the natural or alternative medicine as well. It's like, I think that's indicative of what a broad subject it is. For me, health is completely linked with consciousness, and that comes after years of being a therapist, CranioSacral Therapist, which, without getting into the nitty-gritty of how craniosacral therapy works, but it basically helps your body fix itself. It sort of starts with the premise that your body knows how to fix itself and that it's stuck in that process of fixing itself. And the good craniosacral therapist facilitates your body to do what it's already trying to do. So I've got more than a passing interest in health. I work in health, in training craniosacral therapists, and with the open source Cranio project, helping to foster craniosacral therapy in developing countries. So yeah, I've got more than a passing interest in health, and I've thought about why we get sick and why we get better a lot. I wrote a book about it. It's called Why Do We Get Sick? Why Do We Get Better? With the tagline of a wellness detective manual. And this thing of consciousness and health, when I say consciousness, I don't mean that in an airy-fairy kind of woo-woo kind of way. I mean it in a very practical approach, and in how you decide to approach health. Because often people don't think about health until they're sick, and then suddenly I've got to, now I'm going to start thinking about my health, and that's fine. That's human nature to just take things for granted. It just seems like we're wired like that. Unless something's taken away from us, we don't seem to appreciate it. But health starts way before you ever get sick. It starts with being conscious of your body, and conscious of what's going on in your body, and conscious of what messages your body is sending you on a daily, moment-to-moment basis. Again, that's not airy-fairy. I don't mean like you have to sit in meditation and listen to your body. Some part of you knows, for example, that you shouldn't eat that extra piece of cake, or that you're full. You feel full, and you keep eating. Some part of you knows that that's not a great idea, that you're going to feel, bad inside, that's going to put your body under a lot of strain. So you could say that your mouth has one kind of consciousness and your stomach has a different consciousness, because if the consciousness that was in your stomach was in your mouth, you'd never overeat, because your stomach would go, no, that's it, full, no more room, stop eating. Whereas your mouth is just like, I just want to eat more, yeah, get it. It's like the Cookie Monster, just keep eating. So there's two different consciousnesses going on there. One is your mouth, and one is your stomach. That's just a small example. Another example is you're sitting at the computer, you're completely engaged in what you're doing on the computer, and then when you finish doing it, suddenly you realize your neck is as tight, and you're rapidly developing a headache, and now that you come to think of it, your eyes are kind of sore, none of which you were aware of 10 minutes beforehand when you were engrossed in what you were doing on the computer. That's kind of what I mean about consciousness. But then also there's a part of you that will look at the different things that you eat, because a lot of what you eat has a big bearing on how you feel. But the time delay, the more there is a time delay between what you consume and the effects of what you consume, the easier it is to kind of not think about it. Like smoking is a good example. Like in some way, in some ways you can look at people and go, is everybody nuts? Why are they smoking when it's really obvious that it's bad for you? But then in another way, smoking is great because people wouldn't do it unless it was great, unless it was like they were getting a lot out of it. I used to smoke years ago. I started smoking when I was 28. I smoked for 2 years solidly until I was 30, and I was like very addicted to them. I smoked about 40 cigarettes a day. Loved it. Loved every minute of it. They're brilliant. But I've never I never had so many chest infections because my poor old lungs couldn't handle it towards the end. Initially, first year I was probably grand. I don't remember it, but in the second year I remember getting progressively worse and worse chest infections. So I stopped. So because the delay between the effects of the cigarettes and the enjoyment of smoking the cigarettes was long, it was easy for me to kind of go, yeah, sure, yeah, I'll get around to doing something about that. I know it's not great, but sure, I'll get around to that. And I think we do that with a lot of things. The bigger the delay, the easier it is to forget about it. Also, I think a lot depends on how you view your body. If you relate to your body like it's a machine, a bit like a car, that breaks down every now and then, you have to bring it to somebody and the mechanic and they do stuff and give it back to you and it's all fixed and you can just drive it away until the next time it breaks down. If that's the way you relate to your body, and a lot of people do, then chances are you're going to get sick more often, I think. It's certainly been my observation. Because if you think of it like that, you'll just kind of go, yeah, well, I can eat as much shit as I like. Burgers, chips, cream buns, the lot. I can eat all that sort of stuff. I can drink Coke till I'm blue in the face. I can drink my brains out. I can smoke. I can do everything. And then when the machine breaks down, I just bring it to the doctor and go, look, you fix it. Because, doctors have trained. They've spent years training how to be doctors. They're bound to know more about my body than me. So, if you take that approach, you'll find that, I've found anyway, I've observed with people, that you'll end up going to the doctor more and more. You'll end up breaking down more and more. And that's not the doctor's fault. I'm not having to go at doctors, because doctors are generally they're overworked and underpaid. So they've got that going on, plus they kind of relate to your body like a machine as well. And of course, the simplest thing to do is just, they in the same way abdicate their responsibility onto the drug companies and the research that's being done about what the best way to, this latest drug to do whatever thing you're trying to fix is. So it's much easier for them to kind of go, look, take the drug and come back in the morning, or take two and call me in the morning is the kind of joke. But it's much easier to do that because they've got if you go and see the doctor, they've probably got another 20, 30 people that morning that they've got to see. So whatever's quick and easy is easy, and you can't blame them for that because, as I say, they're overworked, underpaid. And if you're going to be irresponsible about your body and going to go, here, fix me, well, they're not going to say, well, now, hang on a second, did you ever think about your body? Did you ever think about the way your body works and how it's, it's not a machine and all this kind of, they haven't got time for that. They haven't got time to stop and educate you about it. And maybe you don't want to be educated, and that's your choice, of course. So the other approach is that your body isn't a machine. That your body is a printout for everything that's going on for you. Inside, outside, whole of your life, printing out through your body. That's another approach. And in that kind of approach, your body is this amazing system, or it is a system. It's a system of cells and systems that all work together, and that it's designed really well, and it's designed to adapt itself all the time. The technical term for that is homeostasis. Your body's always trying to find balance. Whatever situation you're in, your body will always try and find equilibrium within that situation. Now, if you came across somebody in a park, for example, and let's say they're in a business suit, they're sitting on a bench, they're sweating profusely, and they're out of breath. You could kind of go, there's something wrong with this person. I think they are having a heart attack, maybe. And if you went up to them and said, are you all right? You look like you're having a heart attack. I wouldn't recommend you do that. But if you did, and the person says, oh no, I've just come from a meeting and I just ran across the park. Then you go, oh sure, that's grand. I understand now. You're not sick. You just ran across the park, right? Now, what happens in your brain when that happens? You switch. You go, oh right, they're not sick. They're not symptoms anymore. So they're not. That person's not sick. They're not symptoms. That's just what happens when you run across the park in your business suit. Now, I don't draw that distinction because what we call symptoms, to me, it's the same thing. It's your body's expression of how it's trying to deal with things. So, if you get an infection, first thing your body does is try and kill the infection. And how it does that is it raises your body temperature to try and kill it off. Okay. Now, we generally think temperatures are like, oh no, it's a symptom, he's got a very high temperature. Now, extremely high temperatures are, not great. I'm not saying they're great or anything, but just general temperature increases, that's an indication of your body trying to fix itself. And I've found that when you approach this, when you look at your body from the perspective of what is it trying to do, rather than, oh, I'm sick, then you can kind of see the beauty in the way that it does try and fix itself. Now, I'm not saying if your body could completely fix itself, no one would get ill and die. But often, that naturally correcting mechanism gets overwhelmed, and that's when people get very ill. Like if they have a very serious infection, that kind of thing. But most of the things that your average kind of person is going to get, like we're in Ireland now at the moment, okay? I'm in Ireland at the moment. And it's sort of the middle of February. And the number of people that are ill with flus, colds, and everybody's just like, yeah, well, of course you get a flu, of course you get the cold. It's cold all the time outside, it's understandable. Now, I haven't had a cold or a flu or anything this year, all through this winter. That's not to say I won't. I probably won't. But I don't expect to. And I don't think it's kind of just, well, that's just what happens. But then I don't relate to my body like it's a machine. So I might sort of feel there's something coming on, and I'll sort of take measures to kind of help my body. And over the years, I've just discovered different things that help my body remedy itself. But if you don't like that kind of having to think about it that much, and your body is just this thing that you drive around in, then you're going to be putting a lot of faith in doctors. And that's fine if you want to do that. But then bear in mind that doctors are overworked and underpaid, and they're going to go for the easiest thing. Not because they're bad people or anything, but just because they're overworked. They've got, there's 40 more people after you can be sure of it, in the waiting room. And if you have been drinking, smoking, not exercising, just generally, the message you're saying to the doctor is, I don't care about this thing that I'm in, so, just give me something to keep me going. Just give me a patch of some kind. Of course the doctor's going to do that as well. He's just going to say, well, look, this is the latest pill. It's brilliant. Here, have a go. And that's the other side of it is, it's amazing to me how much faith people put in the medical profession and in science. As if like science lives in this ivory tower where the beautiful scientists all work in this pristine, ethical, wonderful environment that's got nothing to do with the everyday stuff that's going on in the world, where that's like not the case at all. You only have to look at the propaganda for cigarettes that went on when it started to become obvious that cigarettes weren't that great for you. The number of studies that came out at the time that advocated, oh no, cigarettes are grand. You know, studies that were had doctors involved. Doctors saying, oh yeah, no, cigarettes. You watch any movie from the 50s and all the doctors are smoking. Because, you know, there was a debate about whether it wasn't very good for you. And if you go back in the 50s and you were going, I don't think that's very good for you, you go, oh look, there's 26 reports there that there's nothing wrong with smoking, it's fine. Whereas now it's pretty obvious that smoking is not great for you. It doesn't help at all, and it puts your body under a lot of strain. Your body is, you know, if your body is if you think of homeostasis as this kind of balancing act that your body is trying to do all the time, smoking is kind of like putting an elephant on the back of this person who's trying to balance on a tightrope, you know. It just makes it very hard. But that was back then. That was the 50s. Like, yeah, sure, things are much different now, aren't they? None of that kind of corruption goes on now. Of course it goes on. All you have to do is, you know, it's like the thing that I always say in the movies, follow the money. Like somebody's making money out of drugs, you know, pharmaceutical drugs. Every drug, I think the biggest drug, biggest money-making drug in the world is chemotherapy, I think. I know when AIDS medication came out first, my God, it was incredibly expensive, right? And there's a movie at the time. I remember like reading about the AIDS medication and how expensive it was. And because I kind of think like this, I was going, oh, well, that's something fishy there. And now the Dallas Buyers Club, that's the name of the movie. It's just out with Matthew McConaughey. And like, here we are. That was like the 80s, right? And here we are now in the 2000 and whatever. 14, and you know, looking back in recent history and kind of going, oh yeah, well, somebody was actually trying to make some money off all the people who had AIDS. Like, horrible. Yeah, but that doesn't go on now, of course. Oh no, there's nobody trying to make money out of medication and pharmaceuticals. No, that's all based on real science in the pristine ivory tower that real science goes on in, you know. It's like vaccination. Oh my God, vaccination. Huge debates going on about vaccination. Now, I'm not coming out one way or the other about vaccination. I think everyone's got to make up their own mind about that. But the number of people who like talk about real science and real studies, and the anti-vaxxers are all crazed hippies. Like, to me, it's really like simple in terms of like, if you follow the money, okay, you take a bunch of crazy hippies, let's call them crazy hippies, who are anti-vaccination. What's in it for them? Really, what have they got to benefit from it? At the very most, they get bragging rights that they were right. That's about it. All they get to do is thumb their nose at everybody who said vaccination was brilliant and that they've been saying for years that it's not great. All they get out of it, if they're proved right, is they get to go, well, we told you. That's it, okay? That's all the mad hippies get, okay? On the other side, what do the pharmaceutical companies get? They get loads of money, billions and billions and millions of money. Dollars, euros, whatever. Just that simple fact on its own would make me suspicious of the pharmaceutical companies, because you can be sure they're behind all the great studies proving this, that, and disproving that, and vaccination leads to autism. No, we've 26 studies, just like, you know, they're right beside the ones for the 26 studies we had for the smoking back in the 50s. Yeah, not that pile, yeah, the vaccination pile, yeah. There, look, there's all those studies that, you know, oh no, there's no link at all. I'm not saying there is or there isn't. I'm just saying if you just take simple, follow the money, I wouldn't trust the pro-vaccination. But what is remarkable and remarkably sad to me is how insidious that whole issue is, because they basically get parents where they're very vulnerable, which is about their kids, and they basically convince the parents that vaccination is a great thing, and that they're actually doing a big disservice to the child if they don't. Like, every parent loves their child, okay? So every parent is diligently going to do their research, right? And they're going to try and get the most amount of information, and they're going to try and do the best thing for their child, okay? And they make the decision. And let's say they decide, yes, I've read all the material and I am convinced that vaccination is not only important, it's vital for my child, right? That makes it very hard. Once the needle goes in, it makes it very hard for that parent to revise that decision, because they've done it now. So they've got an investment to kind of back it up, because unless something terrible happens, and unless, and I've treated kids myself whose parents say categorically, prior to vaccination, my child was not autistic. It's clear as a bell to me, right? Now, that's what was told to me. I didn't know the child beforehand, but it's happened. I treated a few kids over the years like that. Parents were convinced. So I've got that, and then from the other side, I've treated loads and loads of autistic kids over the years, and the ones whose parents said that they were autistic, and there was a direct link in the parents' mind between when the child was vaccinated and when they started to exhibit autistic symptoms, I wasn't able to help them. Systems felt very different. Now, CranioSacral is a very subjective, immersive kind of thing. They could have influenced me. There's many things, right? Everything is subjective, I suppose, in a way. So I'm not saying, again, categorically one way or the other. But the poor old parents who decided to vaccinate, if nothing went wrong and the vaccination went okay, and, the drug companies that make the vaccines, they're betting on the odds. It's like going to the casino. Most of the time it's going to work, and the times that it doesn't work, well, we'll live with that. We won't actually live with the child. We'll leave that to the parents, but we're okay with that. So if the parents vaccinate the child and everything goes fine, well, then they're going to be very invested in that they made the right choice. So the drug companies sort of, without meaning to, the parents have kind of been enlisted into the drug company's propaganda, which is awful. And so it goes, and so, and eventually they start becoming super militant, and they start to pass laws insisting that everybody gets vaccinated. And the drug companies are laughing all the way to the bank, because same thing again comes down to very simple: who's going to benefit from that situation? You could say, oh well, society as a whole is going to benefit because we've eradicated polio, we've eradicated this disease, this terrible disease, and that terrible disease, whatever. If nobody was making any money out of this, I would have a lot more time for that. But you have drug companies who have huge amounts of money to invest in studies, doctors, research scientists, all of, buying all the sort of things that you need to make a nice statistic. And then on the other hand, you've got the crazed hippies and the crazed parents who are trying to mount the balancing argument to that. And they don't have any of the resources and have nothing like the resources. So their studies are going to look, they're probably not going to do them right. Or if they do them right, leave one T or one uncrossed or one I not dotted, and they make their studies are going to be easy to poke holes in. And of course, on the other side, they've got armies of people ready to poke holes in them. We're all getting paid to do it. So I would view them personally with a grain of salt. I would give a little bit more credence to the anti-vax studies and stuff. I'd give them a bit more latitude because I know they don't have the resources. And on the other side, I just treat them with a lot of suspicion. But that's just me. But then to me, it's just money. It just comes down to money. The hippies are not making any money, or the anti-vax crowd are not making any money from it, whereas the drug companies are making a huge amount of money from it. Anyway, that's a little side thing there about money, but it all about vaccination. But I think the vaccination thing it's a good way of highlighting the how people relate to drugs, pharmaceutical drugs, prescribed drugs, and how people just trust. They have this huge trust in the medical science, and indirectly they have a huge trust in the drug companies without even realizing it. Because I think the second biggest drug seller is Lipator, which is an anti-cholesterol or a statin, and it has all sorts of side effects. And I have experience of this myself, because a couple of years ago, about 5 years ago, I was a bit overweight, and I was having very mild chest pains. And there's a history of heart trouble in my family, so I decided that it might be a bit foolhardy to just ignore it. So I went to the doctor, and they said, oh, your blood pressure is a bit high and your cholesterol is too high. Here, we're going to put you on these 2 drugs. And they frightened the life out of me. And because when they took my medical case history and they saw the history of heart problems in the family, they were like, oh, well, you better put you on this drug and that drug. And again, that's fine. I'm not having to go at the doctors, because there were probably, as I say, 40 people in the waiting room behind me, and you just add. For them, it was like, oh yeah, there's a history of heart issues in that family, and he's saying he's got chest pains, his cholesterol's too high, and his blood pressure's too high. Let's stick him on the drugs. And next. So, as part of it, I was signed up for this yearly blood pressure monitoring thing, where you wear a blood pressure thing for 24 hours. And time passed, and because I was listening to my body as well, and I stopped drinking, I lost weight, I got rid of things that were stressing me in my life, and I can vividly, every night and whenever I think it was every night, I had to take this blood pressure thing and this Lipator thing. And after about 6 months, and now I have to say I was on very mild doses of both of these medications, I really started to feel like I was having to put something in your mouth every night. It was very much affirming the fact that there was something wrong with my system, and I just was like, no, I don't think this isn't really helping me. I know it's not really helping me, but it was very hard to take the step and I'm just going to stop taking this stuff because I don't think it's helping me, and I think my body will sort itself out, and I've made changes. And I think it'll be all right. Now, I'm not saying anyone should do that. I'm just telling my particular little story. Not advocating anyone to do that. Because what I found is that even though we don't live in a tribe anymore, but the doctor still has the kind of power of the witch doctor. Because there's lots of statistics about the number of people who are told by the doctor, you've got 6 months to live or 3 months to live, whatever. The number of people who died right on the day, bang on the day. The percentage of people, it's like 90% or something really high like that. And that's not to say that the doctor killed them with their words or anything like that. But I have a lot of knowledge about natural medicine. I have a lot of knowledge about how your body's is able to fix itself and so on and so forth. But I am very careful what I let doctors say to me, because I know that it's very hard to get it out of your head, and it's very hard to fight against it on the inside, So with me, and even with all that knowledge, I was still sitting on the side of the bed going, I think I'm going to stop taking these. I don't think they're helping me. Anyway, I did. I stopped taking them, and but I still went to this yearly blood pressure monitor thing. And the last time I went, which is, I don't know, a couple of years ago, the woman who was, read the readout from my blood pressure thing after they had taken my cholesterol and so on, she was kind of going, are you sure you're supposed to be in this study? Because, your blood pressure is perfect. Better, probably, it's more like something of a man 10 years younger than you are, and your cholesterol is grand, and basically, what are you doing here? Now, I don't know if I had kept taking the statin, the Lipator and the blood pressure, I don't know if I would have had that result. But that's just me in an ordinary little body. given it a chance to fix itself. Now, when I say given it a chance to fix itself, I stopped drinking, which I think was probably one of the main contributors to the high blood pressure and the cholesterol. I'm not saying that's the case in everyone, but as I listened to my body, and yes, that I did listen to it in meditation, as well as just generally. Eventually I got the signal that I should stop drinking. And then I started to eat less, I started to exercise more, and do things that would help my body fix itself. That's kind of looking at the whole thing from a very mechanical point of view as well. And I think you have to look at it from a very mechanical point of view, because your body is a physical thing. It's like certainly, you can touch it, it behaves in a reasonably predictable way. If you don't drink water, you'll get thirsty and start to dehydrate, and you can get into all that sort of side of it. There's also lots of, like stress, for example. Stress is extremely toxic in your body. I've done studies on that as well, on how much damage stress can do in your system. I often used to observe with people, you could have two people, both of them smoked. One of them loved smoking and didn't care about it, and the other person felt like they were inhaling cancer sticks, and every time they had a cigarette they were affirming what a terrible person they were, and how bad it was for them, and what a failure they'd no self-discipline and no self-control, and oh my god, extremely negative. It's a very stressful experience. And it often looked to me anyway that the person who really enjoyed the smoking was probably doing a lot less damage to themselves than the person who was smoking and giving themselves a hard time for smoking as well. There's lots of other factors to do with why your body might be giving you symptoms. Like there's a condition called tension myositis syndrome, and it was coined by this Dr. John Sarno in New York, and it's to do with back pain. And he has this clinic for treating people with back pain, and no surgery, no drugs, no nothing. And his treatment consists of a 2-day seminar. Now he's got a very stringent assessment process for whether you're qualified for this treatment, this 2-day seminar. And once you get through that, then you'll probably have a good chance of it succeeding. And basically his idea is that there are certain kinds of back pain that are caused by your brain. Your brain sends a message to the capillaries in the big muscle groups in your back to constrict the capillaries, the blood vessels, small blood vessels in the muscles of that area, and give you a lot of pain. So it doesn't constrict the blood vessels enough to cut off blood supply. It just it constricts it enough just to send your muscle into oxygen debt, and you have a lot of pain. Now, why would your brain do that? His hypothesis, or his approach, is that it generally does it if you're in a situation that has no solution. You're in an impossible situation where there's intense emotional pain that you don't really want to face, or you can't face, or there's no point in facing because it's not solvable. Your body will, so if you measure emotional pain, it's like your brain doesn't make the distinction between emotional pain and physical pain. So let's say this issue is an 8 on the scale. 10's the absolute worst, and this is an 8. So your body will give you a physical pain of about 6 to distract you from the 8. That's the sort of thinking of it. So you have incredible back pain, you don't have to think about this particular issue, people feel sorry for you, you get to take time off work, whatever it is. Now, he's not trivializing it. He's not like kind of going, oh, for God's sake, it's cop on, or pull yourself together. Because what he says is that the kind of issues are very specific, and as I say, they're unresolvable. So just to give you a few examples, be like the man who hates his job but wants to provide for his wife and 3 kids. So he goes to work every day, but he hates his job and he really wants to be something else or do some other thing. So when he can't see any way out of that situation. He wants to provide for his family, but he also wants to be whatever he wants to be, and doesn't want to go to this particular job. So that unresolvable conflict is the sort of thing that could end up in tension myositis syndrome. He could develop terrible back pain. Or say somebody who has to look after an aged parent. Of course they want to look after their parent, but they don't really want to. But they do want to, but they don't want to. There's no way out of that. That kind of thing can lead to tension myositis syndrome as well. Anything that's kind of unresolvable, your brain kind of goes, that's way too hard to deal with, and the pain involved is just too high, so let's have a smaller physical pain, so I don't have to think about that bigger emotional pain. Now, the remarkable thing is that Dr. Sarno has a very high success rate. Now, you could say, well, of course he's got a very high success rate because he screens everybody so stringently. But he doesn't talk about the treatment until you get onto the 2-day seminar. And I think the first day is explaining the medicine behind how your brain could cause you so much physical pain. Because he has all these x-rays of somebody who's got an extremely curved spine and then somebody who's got a straight spine, and the person with the really curved spine has no pain and the person with the dead straight spine has got chronic pain, and he just uses this as an example of how it's not a obviously physical problem in the way that they've been thinking about it. So the first day people are kind of slowly coming into getting the idea, and bear in mind he's a doctor, so it's the doctor telling you, so that has a bit of weight as well, as I was saying earlier on. And then the second day is how to deal with it, and his approach is basically, once you understand what's happening and you accept that that's what's happening, then that starts the process. One of the things that characterizes tension myositis is that you get the back pain, or it's always in the form of an attack. You get an attack of it that puts you down for a couple of days. So when the attack comes, it's to not buy into it, to basically look into your life and see what is the unresolvable issue, try and find that, and then focus on it. And basically what you're saying to your brain is, the jig is up. There's no point in trying to distract me from looking at this because I'm already looking at it. And this unresolvable issue, I'm looking at it, I'm feeling the emotional pain associated with it. So you don't need to distract me with an emotional pain, with the physical pain. And when the physical pain comes, to not buy into it, to not believe it. I think they talk about laughing at it. I don't know if I could laugh at a back pain if I had a back pain. But anyway, I think it's a very useful example of how pain, symptoms, things that go on your body, things that we call sickness, are all. It's very simplistic to just go, oh well, I'm sick and I just want to suppress, because a lot of symptom suppression just makes things worse. But a lot of medicine is geared towards symptom suppression. Eczema is a good example of that. Often. The allopathic approach to eczema is generally some kind of steroid cream. It'll escalate up, but generally it'll eventually get to steroid cream if you can't sort it out. And you put the steroid cream on the eczema, and the eczema goes away, and everybody's clapping themselves on the back going, "Oh, isn't that great? Now I got it." But then when the child or the person develops asthma the following year or within 6 months or whatever, everyone's going, "Oh, we've got a new set of symptoms now," which is probably not the case at all, because if you suppress the eczema on your skin, it just goes to your inside skin, which is your lungs, and it just expresses itself there. Again, I'm not giving any advice or anything, I'm just saying these are things I've observed. And if you take the approach that the symptom there's no accident to the symptom, it's not just a random anomaly, that's a hard word to say, anomaly. It's not a random anomaly. Let's see. It's not a random anomaly. It's significant, and it's telling you something. And it could be telling you something about something very deep in your system. It could be an emotional thing, or it could be a deeper thing. It could be to do with what your whole life is about. Why people get sick and why they get better, and I go into that in my book a lot as well. Okay, so talked long enough about health for now, but it's good, I think, to ask yourself the question: what am I trying to get my attention about? If I took the perspective that my body was working perfectly, and it was that these symptoms are an expression of my body working perfectly, what are the conditions that my body would be working under that might be causing this current situation that I'm having? Looking at it that way rather than going, oh no, I'm broken. There's something wrong with my system. I better go and get the mechanic to fix it. I think if you take the approach of what are the conditions that my body's trying to find equilibrium within, you'll feel a lot more empowered, I think, about your health. It's a nice feeling to feel like your body is this wonderful thing that is designed to fix itself, and you're trying to figure out how to help it to do that. Okay, that's all for now. Like the podcast, leave a review. It all helps bring the podcast up on the charts. And till the next time.